Knee replacement surgery, also known as knee arthroplasty, is a procedure to replace the worn out or damaged surfaces of the knee joint with artificial parts, typically made from metal and plastic. The goal is to restore function and relieve pain that can't be controlled by other treatments. Here is a basic overview of how the surgery works. Preparation. Before the surgery, the patient undergoes a thorough physical examination which includes X-rays or MRI scans to determine the extent of knee damage. The patient will also discuss anesthesia options with the anesthesiologist. Anesthesia. On the day of surgery, the patient is given anesthesia. This might be general anesthesia where the patient is completely asleep, or spinal epidural anesthesia where the patient is awake but numb below the waist. Incision. Once the anesthesia takes effect, the surgeon makes an incision in the front of the knee to gain access to the joint. Removal of damaged cartilage. The surgeon then removes the damaged cartilage and bone from the surface of the femur, thigh bone, and the tibia, that is also called shin bone, that forms the knee joint together. Reshaping. After the removal, the ends of the femur and tibia are reshaped to fit the prosthetic components. Implanting the prosthesis. The surgeon attaches the metal implants to the bone, one at the end of the femur and one at the top of the tibia. These components can be cemented to the bones or press fit, which allows bone to grow into the implant. That is all about reshaping. Inserting a spacer. A medical grade plastic spacer is then inserted between the metal components to create a smooth surface that mimics knee cartilage and allows for movement. Closing the incision. The surgeon closes the incision with staples or stitches and applies a dressing. Resurfacing the patella. Depending on the condition of the patella kneecap, the surgeon may resurface it and fit a plastic button on the underside. Though not all surgeries involve the kneecap. So you can also find kneecap in the market after the operation. Post-operative care is crucial, involving following the surgeon's instructions, attending physical therapy, and gradual return to activities. Full recovery and the maximum benefit of the surgery may take several months. The longevity of the artificial knee varies but often lasts 15 to 20 years depending on patient activity level and factors.